Okay, well, today we're going to be doing another quick video about vitamins. This is kind of like the part two. Today we're going to be talking about vitamin E, vitamin C, and some of the really important B vitamins. But yeah, so I'll go through a quick preview, kind of talk about everything else like signs, symptoms, what you can expect, and some of the presentations that patients have when they're deficient in these vitamins. So let's start with vitamin E. Vitamin E, also known as tocopherol, is super important for predominantly free radical pathways. So, what does that mean? So, in our body, we produce free radicals in the electron transport chain, and free radicals are bad. They can cause cancer, they're damaging, it's just not really a good thing. And how we get rid of them is this pathway that it's called the free radical antioxidant pathway. So when we say something is antioxidant pathways, it means that it can decrease the amount of oxidizing free radicals in your body. So we say blueberries, stuff like that, have free radical antioxidant properties. So this pathway right here, and this pathway directly involves vitamin C. So what happens is the electron transport chain, which produces all the NADH, which kind of ATP that kind of runs your body, it will produce these oxygen free radicals, which will then reactively turn into free radical hydroxides. These hydroxides will then be picked up by something called PUFA, which is this lipid like molecule that its entire job is to pick up these free radical hydroxyls. From there, these PUFA radicals will change into PUFA paradoxial radicals, where they will come in contact with the vitamin C and vitamin E pathway. So something I mentioned, we're going to talk about vitamin C later. Both of these are super important, vitamin C and vitamin E in this pathway. They're both code factors. So the PUFA peroxidyl radical, which just has that PUFA molecule with the OH group, will come in contact with vitamin E and it'll remove the extra electron off of that group, forming a PUFA peroxide. The PUFA peroxide will come in contact with the glutathione reductase, which will then just produce a PUFA alcohol, which then can go off and be used for other things. But let's keep going. So that vitamin E, if you remember, it takes the extra electron from that free radical attached to the PUFA and forms tocopherol. Tocopherol will then come in contact with vitamin C, which will then take it and it'll form dihydroxy absorbitate, which then comes in contact with GSH and GSSH, or GSSG, sorry, which then those are really important as well for this free radical antioxidant pathway. And the GSSG will take that electron and give it eventually to an NAD. The NAD will then turn into NADH, and NADH will go off and do its thing. So all of these are super important for getting rid of these. It's kind of like a toxic byproduct of producing energy in our body, and this is just a process of getting rid of it. And it uses a lot of vitamin C and vitamin E. So vitamin E is fat soluble. It's in eggs and meats, and it's stored in our adipocytes or our adipose tissue, so the cells that are fat cells. Um, and so that's the number one purpose of vitamin E is used in this free radical antioxidant pathway. Number two is it helps a lot with platelet aggregation, cell proliferation, and some monocytic adhesion. You can think of pathways like the phospholipase A2 pathway and the protein kinase activity, LPK activity is important as well. And it can also help with decreasing gene transcription. So those are three just big things vitamin E happens but the big one is the one I talked most about, which is the free radical um, antioxidant pathway. So let's talk about what happens when a patient is deficient in vitamin E. So you're going to see a lot of liver disease and a high risk of similar things when you have a lot of OH free radicals floating around in your system, right? So you're going to see liver disease, post splenectomy, something called abetopropotinemia. I'm probably butchering that. Um, and the most important for identifying someone with a vitamin E deficiency is looking at the histology. So usually on this exam, have a picture of cells, and they'll have these little spiky dots around the cells. Those spiky dots are formed free radicals causing mitochondrial damage, and that mitochondrial damage will come up as these red dot spikes um, called spiky iconocytes, I think. And so you also see a lot of neurological damage in your body, especially specifically in the demyelination of the posterior column of your spinal cord. And you'll see that a lot with antioxidant or just oxidant damages. So, like if you're not able to, if you have like a GSH or any of these deficiencies in that antioxidant pathway, you'll see a lot of neurological symptoms, specifically demyelination. That's very common. So we oftentimes will use vitamin E when we're treating non-alcoholic steatohepatitis, and I'm definitely mispronouncing that incorrectly, but that's a very specific use of that. So let's move on to water vitamin C, which I know a little more about. So vitamin C is got mostly in citrus fruits. Vitamin C participates, like we spoke previously, in the antioxidant pathway, and also that helps a ton with iron reabsorption, as well as um, it's a synthetic enzyme cofactor. So things like collagen synthesis is the big one, right? So that helps with hydroxylation and prohydroxylation of proline and um, tyrosine, I want to say. Proline and lysine, that's what it is. So that hydroxylation process is necessary for producing type 1 collagen, and that'll make sense in a second here. So when you see vitamin C deficiency, what's like the big disease that everybody thinks of? It's scurvy. So what are some of the symptoms of scurvy? It's swollen gingiva, translucent teeth. You'll see people with a decrease in collagen. So there's going to be a wide variety of issues like corkscrew hair. You're obviously going to have poor wound healing if you don't have collagen. Stuff like ocular hyperkeratosis and parafollicular hemorrhaging, which forms a specific type of rosary called scorbutic rosary. So, um, these are all super important. I think the main one for sure that everyone identifies with scurvy is the swollen gingiva and translucent teeth, and the poor and the frizzled corkscrew hair, as well as hemorrhaging issues in general. And that's because vitamin C is a cofactor in the hydroxylation of proline and lysine, which is one that is those are the precursors to create collagen. So if you don't have the cofactor to produce the collagen, you don't have any collagen, then you're going to see all these issues. And then obviously you pair that with antioxidant damage or oxidant damage from all those free radicals floating around your body. It's not good. So this is a second line treatment that we use oftentimes for iron deficiencies. Something that I kind of skipped over super quickly, is that vitamin C helps turn Fe iron to a digestible and absorbable iron. So when we consume iron in our body, not all the time type of iron that we're consuming from spinach or other stuff, can pass through uh, our small intestine, but we change it with vitamin C, and it goes from Fe3 to Fe2 plus, which then is or just not digestible, but just absorbable, right? And so you got to think about, if you're not getting in the same amount of iron, then you're gonna have a bunch of heme issues, right? Which has everything to do with blood, right? So you're gonna be hemolytic, and you're gonna have messed up blood cells, and they could be macrolytic or bigger or smaller blood cells. It doesn't specify, but one specific disease known as methylmyoglobemia is it's when you have this issue where you are not getting enough iron. And so this is a really vitamin C is a really great thing to take for that, because it will help push forward that process of turning that iron into absorbable iron so that you can use it. Let's talk about vitamin B1, thiamine, and vitamin B3, niacin. So vitamin B1 thiamine is super important in a couple pathways. We'll go through this pathway super quickly. Your pyruvate dehydrogenase complex, so the process of turning pyruvate into acetyl CoA. super important. Two, your alpha keto dehydrogenase complex, which is really important in turning your alpha ketones into succinyl CoA. That's part of your TCA cycle. Trans ketolase, which is part of your PPP cycle, your pentose phosphate pathway cycle, and trans ketolase is an important enzyme that can turn the final product in the PPP cycle into back into glucose 6 phosphate. So it kind of like can revert the PPP cycle. It turns ribose 5 phosphate into glycose 3 phosphate, which can then turn to glycose 6 phosphate. So it's just a really important cofactor in a ton of pathways. So you would expect if you don't have that cofactor, those pathways aren't working properly. So you're going to see a lot of symptoms that uh, are physical presentations of those pathways not working. So oftentimes with alcohol and malnutrition, um, and even sometimes with pregnancy, you're going to see a deficiency in vitamin B3, B1. And you can wonder to yourself why pregnancy, oftentimes pregnant women are throwing up a lot. And because of that, they can become pretty frequently, not pretty frequently, but women can become uh, deficient in a wide variety of enzymes. So what are you going to see? So you're going to see the biggest thing is a decrease in TCA pathway activity. So we talked about how making succinyl CoA from alpha ketones is now inhibited, and your ability to turn glucose into acetyl CoA is now inhibited, or pyruvate, because the pyruvate dehydrogenase complex are both blocked. So what is that going to cause? Big decrease in TCA, big decrease in oxidative phosphorylate oxidative respiration, big decrease in energy. So when someone is deficient in B1, you're going to see stuff like confusion, ataxia. Uh, People are going to be lethargic. They're going to be tired. You're going to see, your brain completely runs off ATP in aerobic respiration. So your brain's going to be very tired. It's going to lack energy, and it's going to be very foggy and confused. And you're going to see neurological damage there. Um, what else do I want to mention? So yeah, so with acute, there's two types of presentations here with B1, um, with B1 deficiencies. The first one's called Wernicke syndrome, or Wernicke encephalopathy. I can't say it right, but that is going to be your short-term presentation. So you're going to see confusion, ataxia, ophthalmoplegia, and it's acute. So it's only starting, right? But then you're going to have Korsakoff syndrome, which is chronic. So it's been going on all over your body, and it's been going for a long period of time. And that's going to be amnesia, and specifically the term confabulation they like for some reason. But how you can remember it is coat rack. So you can remember that that if you have confusion, ophthalmoplegia, and ataxia, then you know that it is going to be just acute and TCA cycle oriented. But then if you're seeing confibulation and amnesia, which is the A and the C in the coat pack or coat rack, then it's going to be Korsakoff syndrome. So you also see imaging. You'll see hypersensitivity of the mammillary bodies, and the mammillary bodies specifically use a lot of aerobic respiration, so they're going to be hyperactive and really frustrated because they're not receiving enough energy. So, like I talked about therapeutic uses, we're using beta 1 vitamin supplementation, or B1 vitamin supplementation, thiamine, with malnutrition, alcohol disorders, and pregnancy. Something that we always do is, if the patient is malnourished, you always give thiamine supplementation before you give them glucose when they're starving. And that's because you're just going to worsen their symptoms if they consume more glucose and can't digest that glucose because their TCA cycle isn't working correctly. So something you always do is you give the supplementation, wait a little bit, and then you can give them glucose food or just liquefied sugars, either by IV or oral intake. And that just kind of helps just to remember that you should always make sure that if it is a thiamine deficiency, you're treating that first before you give them food. So vitamin B3 or niacin. Niacin is what turns into NAD and NADP, which is the two things that are taking all those hydrogens and protons and electrons during the TCA cycle. They're involved in so much stuff during your basic metabolism, uh, all the way from glycolysis to the ETC electron transport chain. And basically, if you don't have niacin, then you don't get any NADP or NAD, which means your oxidative antioxidant pathway isn't working correctly. Nothing is taking those electrons, right? So you're going to have free radicals. What does free radicals do? Causes a lot of neurological problems. So your side effects here are going to be pellagra, which is the big three that we talk about. So you're going to see the big three Ds is what you use to describe pellagra. And pellagra is the three Ds is diarrhea, dementia, and dermatitis. Specifically, you see this tape-like rash in their C3 to C4 dermatome region. And yeah, so you'll also see ataxia and other like neurologic or uh, spinal cord issues. Um, yeah, so that's that's niacin for you. You use niacin as well. You can use it as a antidote or a some type of prescription for hyperlipidemia because it decreases LDLs slightly. So vitamin B6, also known as peroxidine, also same thing, right? Malnutrition and alcohol disorders. And this is where you see a lot of neurologic peripheral issues, including sideroblastic anemia, um, beta 6, B6 vitamins are used in specifically transamination stuff and decarboxylation stuff. So the production of dopamine, histamine, and serotonin, as well as heme synthesis, all uses B6, while cofactors to produce ALT and AST from in your transamination reactions also use B6. So basically, you're not producing DOPA, which means you're not producing dopamine, norepinephrine, serotonin, and other issues like histamine. So lots of neurologic issues. And then obviously, sideroblastic anemia, because you don't have ALAs, you cannot produce heme. And because you can't produce heme, there is no Fe2 being incorporated. So you have this buildup of Fe2 in the mitochondria. Um, so yeah, that's sisteroblastic anemia. So that's the video for today. I did this a while back, so I feel like it was a little hard for me to remember everything. Something I didn't mention about thiamine is something called beriberi, which is more presentations besides Wernicke encephalopathy and Korsakoff syndrome. So beriberi can be produced as dry, wet, or infant, which is both. And dry beriberi is where you're having nervous system problems, which are all can lead to Wernicke syndrome, while wet is cardiovascular issues. That's because um, it depends on what type of thiamine deficiency you have and where. So, like we talked about, oxidative respiration is really important for your brain, but it's also really important for your heart. And so, it can either be impacting your heart or your brain. So, wet is it's impacting your heart, and then the type of thiamine deficiency of beriberi is impacting your heart, while beriberi dry is impacting your brain. And then with infants, it's this mix of both. and some of the conditions and presentations that patients have with wet beriberi is systematic vasodilation, high cardiac output failure. You'll see a dilated cardiac myopathy, so dilated heart with dry nervous system, symmetrical peripheral neuropathy, and muscle wasting. Muscles aren't able to contract when they're supposed to. And then infants, they get a little bit of both, including cerebral edema. And yeah, forgot to mention that. But yeah, there's my video. Sorry it was bad, but at least you learned something.